Do we have kids running wide open? Line fit? Wide open. Wide open. I don't think you have to do that. Don't open it. Oh, don't open it. Do we have a pulse, yes or no?
We have the great fortune of having a number of mannequins and various devices that we can take to the bedside, to various units, and call a code and see how we perform with nurses and respiratory therapists and pharmacists and resident physicians all working collectively as a team as they would in a real-life scenario, and be able to identify areas for improvement and be able to practice the way we actually play. I think for those of us that have been involved in any one of a number of different types and phases of resuscitation medicine, there are a lot of communication elements, there are a lot of team dynamics that are absolutely fundamental. And we're realizing more and more that it's less about the fancy medicines and the pharmacology, but more about the simple stuff. It's pushing hard and pushing fast when you're doing CPR, and it's about prioritizing ventilation in certain circumstances. And that really comes down to orchestrating a team.
Okay, let's give another milligram of epinephrine, please. Here's another milligram.
And the way that we coordinate our teams here at UC Davis relies on a lot of different individuals from different walks of life, so to speak, that are thrown together in chaos, that don't know one another. And the trick really is to be able to address those training challenges in a way that makes sense, but is all couched in a safe learning environment. And that's a big emphasis here at the center. We want people to be able to come, not feel threatened, judged, or in any way intimidated, and to learn to do what fundamentally is hoped to be absolutely life-saving.
Stop you here. We'll spend a few minutes kind of talking about what we just did. Then we're going to kind of break this down and revisit kind of some key moments from the code, just to very astutely assess, you know, is this guy protecting his airway? No, not really. Is he breathing? No, not really. Does he have a pulse? I don't feel one. So we're in big trouble already. And you did a nice job of kind of recognizing that right away, calling for help. And that, of course, is when things get a bit more complicated, right?
So here in the Center for Virtual Care, we're taking on another phase of the Code Team Training Initiative that we've been working on for the past year or so. The Code Team Training Initiative really has been about utilizing some of the center resources here at the Center for Virtual Care, as well as the CPPN, the Center for the Professional Practice of Nursing, and our colleagues in both of the centers to step up the educational offerings and use our wireless portable mannequins to actually do trainings in the various wards of the hospital. The phase that our colleagues, Dr. Barton, Dr. Carlisle, Dr. Clark here behind me are involved with, it includes opportunities for us to create curriculum, some demonstration videos, and basically an example of a very smoothly run resuscitation to be contrasted with a very poorly run resuscitation that will then be made available to the learners that they can watch at their wills. We hope to make this an actual piece of what we do as an actual culture change. I think it's really important and fundamental to patient safety to train the way you play, to train as a team and to practice as a team.